Now, under the other classification, we said that we have one, the intracellular cells. We had the intracellular cells. We had also the different morphology. Basically, different morphology, and then we have others. Basically, these others are the one that I don't know even. Basically, different morphology. Now, under the intracellular classification, for the intracellular classification, the first type of microorganism that is there, we have the Mycoplasma pneumoniae. Basically, Mycoplasma pneumoniae can be classified under, according to SchrDbb, under the intracellular microorganism. The second one, we have the ureaplasma. Ureaplasma can still be classified under the intracellular. Mycoplasma pneumoniae and all other mycoplasma. We can have Mycoplasma pneumoniae, we have Mycoplasma hominis, which results with sexually transmitted infection with carrying at the level of the genital tract. Is it clear? All that is intracellular. We have ureaplasma, particularly involves still in sexually transmitted infection and results with urinary tract infections. We have ureaplasma. The next one, we have chlamydia. Is it clear? So we have chlamydia. Chlamydia here is under the cases we have. You can be chlamydia pneumoniae or it can be chlamydia trachomatis. Pneumonia is going to result to atypical pneumonia, and trachomatis is going to result to a sexually transmitted infection. All of them are intracellular. The fourth one, which we have, you can have the rickettsia. Is it clear? Rickettsia is the one that is going to result to the Rocky Mountain fevers. When you have fever in the peculiar location like the Rocky Mountains. Is it clear? When you have Rocky Mountain fevers, we have even the typhus fever or we have the cure fever. Is it clear? All that is as a result of the rickettsia. Is it clear? Infection. The fifth one, after the rickettsia, we can have the ehrlichiosis. Is it clear? The ehrlichiosis, the ehrlichia. Those are the bacteria still which are still intracellular and they result to atypical fevers like Rocky Mountain fever, typhoid fever, typhus fever. Not typhoid fever, please. It is typhus fever. Is it clear? Result to a particular infection like typhus. It is not typhoid fever, typhus fever. Is it clear? So those are the intracellular microorganisms. Is it clear? Now, among the microorganisms, I've forgotten to speak about the Neisseria group. Is it clear? The Neisseria gonorrhoeae, and the Neisseria meningitis are among the gram-negative anaerobes. I've said that there are some classification that I may forget. Is it clear? So under the gram-negative, under the gram-negative anaerobes, we have also the nice. So still here with the gram-negative anaerobes Enterobacteriaceae, we have the Bacteroides, the fusiform bacterium, we have the Gardnerella, the Peptostreptococcus. You have also the Neisseria family under the gram-negative anaerobes. Is it clear? The Neisseria family, like the Neisseria gonorrhoeae, the Neisseria meningitis, they are under the gram-negative anaerobes. Is it clear? Now, the other microorganisms, let's visualize now the other microorganisms that were based on a different morphology.